Well, good morning, everyone. This is our patient who's here for her pre-op appointment for a face and neck lift, bullhorn lip lift, lower blepharoplasty with fat repositioning, and pearl fractional laser. How was your consultation experience?
It was really good. I enjoyed having the information ahead of time so I could read through it yesterday, and it pretty much answered a lot of my questions. Dr. Yu really went through everything thoroughly, and I'm a visual person, so he showed me exactly what he was going to do and where he was going to do and answered all my questions.
Great. And I know you did a lot of research picking your surgeon, so what reasons, did you choose Dr. Yu? And tell me a little bit about the research you did and kind of what led you to Dr. Yu.
I have a couple girlfriends that have had some work done, and I know where they had their work done, and I've had other plastic surgery done with a local plastic surgeon, and I wasn't quite ready for. I've been ready for the surgery, but I was reading Ranch and Coast, and then I saw again in the awards for, I believe it was 2020 awards, where he was awarded top facial plastic surgeon. So I started reading up on him, his credentials, his work, the fact that he focuses only on face, and so I was really looking at his before and after photos. And then coming in to meet with the team, I was really impressed with everything that I read, and yeah.
Well, good. That's great that you've had such a great experience with us so far. How are you feeling now that you just had your pre-op appointment?
Super excited, ready to go, and yeah, I'm really looking forward to the results.
Good. Well, you're in great hands, and we're excited for you.
We have our patient here, and she is approaching her 5-week mark post-op lower face and neck lift, lower blepharoplasty with fat repositioning, bullhorn lip lift, and pearl fractional laser. Can you tell me a little bit about your surgery day and your experience up to the 5-week post-op mark?
Surgery day was amazing. I give kudos to both the nurse and the anesthesiologist, they were both great, very warm, and we shared stories. It was, they were like friends. It was really nice and relaxing. Coming out of surgery, my sister and mom picked me up, and they were amazed how awake and how alert I was, lucid, and went home, felt good, didn't really have an appetite, and that night I didn't sleep, I guess because my surgery was close to 10 hours, so I had a lot of sleep, but I rested, so I was able to rest, and just did everything that I was told. What I got the most relief from was the vinegar soaks, and even the nurse gave me a tip of using gauze pads, getting those wet, putting them in the freezer, and using the gauze pads just as a ice pack. And we even put those in the vinegar wash, and that gave me the most relief from the pearl and from my under eye surgery, my lower eyelid. I think that was the best part, was that the vinegar wash was amazing.
Awesome. And is there anything that you would want to tell patients who might be at the same point in recovery as you are, or might be thinking about having surgery?
Just, I guess, be gentle with yourself and just kind of relax and go through it. The first couple days were rough. I was told they were going to be rough, and they were rough, but after you get past the first couple days and get the head wrap off and everything, it's better. The eyes were probably the most irritating of it because of the swelling, and but just be gentle with yourself and take it easy, and use the vinegar wash and use the Vaseline, and follow procedures, and it does get better.
Awesome. Well, you're looking awesome, and we're so excited for you. Thank you so much.